Good afternoon, Daniel Hungerford Morgan here from the Effective Contractor. How's it going? Today we're going to talk about health and safety, but especially for companies over $200,000 a year in revenue. Now, when you're starting to get over $200,000 a year in revenue, you're starting to take on larger projects, you're building bigger teams, and it's really important you understand health and safety and how it all fits in together. Now, for me, how like to see health and safety is that it's basically the level of health and safety in the company is the level of engagement you have with your employees. So if you've got a really low health and safety, it's people don't really think about, and I think it's a waste of time. Well, then your engagement with your employees is really low, and you need to invest in that relationship. Now, what I want to run you through today is just basically the philosophy, the ideas, the theory behind health and safety. Then I'm just going to dive into a few different areas just to give you a bit of an idea around them. So this is building on the health and safety that we went over in stage zero. It's just taking a step further. So in my past, in my experience, I've taken health and safety seriously because I don't know, you go out on site and I feel that I am responsible for this. If something happens to these guys, it's me. And do I want to go to bed at night? Do I thinking that okay, I don't really care about health and safety, and I don't really care about these guys? Where I do, they've got families. I'm friends with them, and basically, if I don't take care of their health and safety, they don't really think about their health and safety, and things can go wrong fast. And when it goes wrong, it's probably going to be coming back my way, especially if I'm not doing due diligence and I'm taking care of things. So that worked on me, and I was thinking about that, and it kind of I don't know, and I had a sense of respect. I want to do things well. I want to be able to get to the I want to be able to get these guys on board, and health and safety is a brilliant way to do that. So I don't know. I came up with a bit of a plan because in working with other companies, it's just people just disregard it. And so we came up with a bit of a plan. We said, okay, how are we going to do this? And one of the companies we work with, what we started doing is forming health and safety committees. And these committees is basically finding the guys in the field that are passionate about it. And there are guys that are passionate about it and bringing them in, and it's getting a health and safety culture set up. And it's not, you just don't use this culture, health and safety, you use this culture to drive productivity, to drive health and safety, to drive quality. It's all those things that kind of are key to your company, but a lot of companies don't really think about it. So I want to go through just the steps of how health and safety works. Now, the first thing in health and safety is when you've got anyone, it's basically company induction. So you need to be able to bring someone in, you need to be able to induct them in a way that they can understand your company culture, and they understand how things work around here. They understand the hazards, they understand what's required of them, and they understand what they can require of the company in terms of health and safety and what you provide and what courses they go on and what certificates you need from them. That's the induction. You really need to get that done first. You need to do that really well. Now, the second thing is you've got a site induction. Now, I'm going to go over that a little more detail with you now. And so a site induction, I find, is it's a methodology of works in a way, but it works very closely with the site, and it's trying to get the guys onto site so they understand the site as clearly as possible, and they understand what they have to do, and they understand okay where the risks are involved. So the first thing I want to run you through is the site induction. So I find with the site induction, of course, you've got to get the project name, number, address, everything. A project description is really key. So they haven't gone to the site before and they're just going to read this. They get a bit of an understanding from it. The next thing is you need to really have a site contacts. You need to say, okay, who are the positions on site of the client and your guys, and what are their names, what are their contact details. So if anyone grabs this, they're away. Emergency procedures are key. You've got to be able to say, okay, what do we do? Raise the alarm, three horns, whatever it is, mobilization point, site contact manager again for your guys. And you can say the closest hospital, and then you've got the closest hospital here. So it's kind of ticking off what you require. I'm not saying this is everything you require for health and safety in this talk, but it's just to shed some light on it. The next thing is that, well, guys jump to site. They don't really know what's going on. Is the site ready for work? Is our schedule approved by the customer? What are the parking conditions? Where do we park? Site access times. Is access arranged? And then what? Basically, the next thing is, are we ready to go onto site? So what do we need to be able to do to go onto site? Have we met with the client? Have we had the meetings? Who's the foreman? Have we gone over the site? Have we done their site-specific induction and whatnot? The next thing is, okay, so who's on site? What's the role of our guys on site? What are their names? What certificates do they have in place? Do they have everything that's required of the site? Basic PPE on the site. And then it's going through, and what's the JHA? So the JHA has got what are all the tasks that we're going to do on the site. So from A to Z, what are we going to do on the site? Then what are the hazards involved? What's the probability of that? What's the severity of that? What's the controls we're going to put in place? And that kind of there builds, so everyone who's going onto site, they get a really good understanding of what's going on site. They understand what happens on site. They know the contact details of the main people on site. They know the main things around the site. They're not starting from zero and just figuring things out, fumbling around the place. They're actually going in there, inducted, and they understand what's going on. Now, a lot of inductions are poor, I agree, and they aren't done in a good way, and they're a waste. They're basically just to get signatures in place so that people, if anything happens to them, they've got the right paperwork in place. And not saying this isn't, but this has got signatures as well, of course. But that's kind of, it's a structured way. And then what you do, okay, the guys are on site, but now every day you need to be able to going over what's the productivity, what we require of you guys to do that day, what are the hazards. Again, you need to break this larger site induction down from the JHA in it down to the daily pre-starts. And the daily pre-starts are key. It's where you get different guys in the company, in the team who are working with you to basically, I get them to run the daily pre-start, and they go through, okay, what are the tasks we're doing today? So they might talk to the foreman who's running the site, okay, this, okay, who's the people involved in it? Then they go the risks, and they might name off the risks that's involving them. And you require that, so you want that rapport with the guys so that they're filling into this. Okay, how do you eliminate it, mitigate or isolate? What's the probability, severity? And I don't know, what we did in one of the companies is we made a whole lot of cards up around the site, and one of them would pick up the card every day and they'd go over it, and then they go over the hazards and they read it out. Okay, what do you think's a hazard at the moment? Because a hazard is what you feel unsafe about. Now, lots of people go on site and they might just slip and they feel unsafe about it. They could hurt themselves, and that needs to be brought up. Or they feel like a truck was backing in without a spotter behind it. Well, that's a problem. Or they feel like that it's just stored badly, some of the equipment, and they feel like they could get hurt. And it's just bringing that out, and it's getting the guys involved in it and aligning it with the productivity, what tasks you want to do that day, and getting some real rapport going on with the guys. So the next thing after that is, so you've got your JHA, your site induction you did at the beginning, you've got your daily pre-start that you've done. Then you need to be able to look at, okay, then you need to be able to educate the guys. You need to be able to bring education into them and be able to feed them. That's the toolbox. And you need to have safety cards. The guys need to be able to write down what they felt unsafe about that week, and it needs to be able to be talked about in the toolbox. So every day, I used to have my guys write down 3 a week, and you get quite a pile of them, but you go through them and you talk about them and you highlight them, and the guys feel like, okay, this is something that's really important to the company, and they buy into it, and you really start, I don't know, you engage them in a way that they've never been engaged before, and it's a great way to push productivity again through health and safety. So that's the toolbox there. So I'll go through the toolbox just quickly, and the toolbox has to be led by usually whoever's running the site in the company, and you usually do one with the site and the client sometimes as well. But so it's a logo, business details, toolbox. So you've got the title, presenter, date, location, project. You've got the topics that you're talking about. So it could be the safety cards they're filling out that you write in here, or you've got an educational piece that you're going to run them through that you think's relevant to the site. There's lots of educational pieces out there. Hazards, you go through the hazards that were discussed in the toolbox that you're going to rectify. And action, it's really key to take action. If there's something the guys complain about, you have to take action on it. You have to get that fixed as fast as you can. You have to talk to them as you do it, and as it's done, you have to close it out with them. So then at the next toolbox, so they know that you're onto it, that you're pushing this forward. And it's really key. It's key to be able to get this done. It builds a culture, and it brings the guys in line with your vision, because you're investing in them and you're worrying about them. They start worrying more about the company. And then basically it's full name, signature. Now, the last thing I want to go over here is just the effective contractors. This is the health and safety matrix that I like to use. So with all your employees, so sometimes you've got 15, 20, 30 employees on here. You've got all the certificates that they have. You've got the expiry dates on here. You got the driver's license, and you can say it's booked and unbooked and it's expired and whatnot, and you can figure it out. So whenever you need to whenever you do training or anything, it's all here straight away. And what you've got here is that you upload the certificates in here. So you've got the WMIS in here, health supervisors, that's for Jack. And you've got them all there as well for all the guys. So you kind of keep this in up to date. So when the guys go to site with their induction, you know that when you look over their different certification that they've got, it's all here. You can come into here and you can update this. And as long as the guys can access this smart sheet on the site, which is easy to do, then they can provide all the certification if they get audited for that site. So again, health and safety is key. And as you start to get bigger, you need to start getting it to really work. And the big thing is getting that the company induction, getting the site induction in place, getting toolboxes, the pre-starts, getting